Hello out there in television land, and welcome to yet another edition of It's Your Health. I'm with my bride, Kathleen, who's going to go over the latest and the greatest in healthcare information. Make sure you check with your healthcare provider before doing any of the things that we talk about here on It's Your Health. Right, sweetheart?
Right, sweetheart.
Okay.
He's always right.
I love her. We'll be right back after this brief commercial message. Remember, you're watching It's Your Health.
Welcome back, and I love this first cartoon. It's so dark out. What time is it? Is it midnight? It feels like midnight. And he says it's 5:27 p.m.
Yeah, that's going around. And talk about depression. It gets a little depressing when it gets colder and darker earlier and into the fall. And I have a theory about that, by the way.
Oh, you have a theory about everything.
The fall, since we have been alive, if you will, and going off into the things that we do when we're getting older, is that in the fall we've always gone away. You know, to kindergarten, we've left home. Grade school, high school, college. There's a separation anxiety there that plays into it, I think.
You know, you could be right, and I actually hate to say that. But okay.
Okay, you'll buy.
Well, let's start with some headlines
Right,
see what you know about these. Nearly 1/5 of urinary tract infections, which I had, can be linked to E. coli bacteria in chicken, turkey, pork, or beef, and it affects females and older adults. How does that relate?
Well, the meat may be contaminated. You're playing with it on your hands. You don't wash your hands. And of course, when you toilet yourself, you may end up transferring this bacteria to your bladder because that's happening.
It says careful washing and maintenance of clean food preparation surfaces. So that's it.
Yep.
Headline number 2. Protein powders. We've been hearing a lot about protein powders. Many popular of them contain high levels of lead, and plant-based powders show the highest level of lead, which is never good in your body.
Well, if you eat a well-balanced diet, I'm not sure you need a protein powder. It has also been linked with some kidney issues because the kidney filters the blood and has these protein things that are being overridden by it. It can not like that. So a well-balanced diet, and you would use a protein supplement, I would think, if you're ill.
Yeah, only as a supplement, and don't get the chocolate ones because they have cocoa in them, which will only make the situation worse. What is ovulation fatigue, and when will I feel better?
Okay.
Are you going to tell us?
You should do this one, sweetheart.
Oh, okay. If you feel tired or exhausted in the weeks leading up to your period, it's not all in your head. Ovulation fatigue can contribute to symptoms shortly after you ovulate, even if you don't conceive. They're more than usual feelings of tiredness and weakness, exhaustion.
Well, again, we don't want to just chalk it up to something that's simple, and I would advise that women should get annual gynecology exams.
Oh, sure.
And bring these symptoms up to your doctor so they can sort it out.
And the symptoms of ovulation fatigue are very similar to PMS symptoms. Okay, moving away from PMS, let's talk about the benefits and uses of cold-pressed olive oil. Cold pressing is a common way to make olive oil. The highest grades, extra virgin and virgin, are always cold pressed. Tell us more about that.
Well, get a load of this list of things that the cold pressed olive oils will afford you. First of all, it's high in nutrients, packed with healthy fats. There are good fats and bad fats. It contains potent antioxidants which cut down on inflammation and infections and can actually lead to better brain health and longevity. May fight inflammation. I mentioned earlier in previous episodes of It's Your Health, we're like a nuclear power plant. We have a lot of inflammation. Inflammation leads to disease states, vascular disease, sometimes cancers. It will help to fight inflammation. May protect against heart disease from all the above that we just ended up talking about. And may promote brain health. Again, we're looking at your total vascular system, and brain health is certainly part of that. Reduce risk of diabetes, improve blood sugar levels, constipation relief, believe it or not, from the olive oil, and delayed progression of osteoarthritis. May also benefit the hair, skin, and nails, and it's very easy to add to your diet. I have some cold-pressed olive oil, and I put a little teaspoon in a flat dish and get some grain bread and just dip it in the bread and eat it, and we get two birds with one stone. So
Now, is it true that it's better to buy the olive oil that's in a darker bottle, that's better for you?
correct. The glass bottles, by the way, would probably be your best bet. And olive oil can degrade with light and heat. That's why we call it cold pressed. So you want to keep it in a cool place and in a bottle that already comes naturally darkened, if you will.
Okay.
So, moving right along. I pass the baton to you.
Oh, no, I don't want it. That's understanding how Alzheimer's disease progresses. It affects the parts of the brain that control memory, language, and thought processing. It leads to memory loss, impairs your social skills, and affects your self-care abilities. Tell us about the different stages.
Right. Well, it's an epidemic, of course. You live long enough, you're going to get Alzheimer's disease. And so it's actually like a glacier that melts. It doesn't happen overnight. It takes years to develop. 7 stages.
20 years sometimes that you have it before you get the first symptoms.
Yeah, it can be. 7 stages. The first stage is without any symptoms whatsoever, but there are things going on in your brain that's going to tee off into Alzheimer's at a later date. The 7th stage, of course, is the one that's dreaded because you're in a nursing home, you need total care, you're looking at hospice services. So it's an area of intense investigation to see if we can slow down these things. But to a large extent, if you inherited the gene for Alzheimer's, you're kind of stuck with that. But the risk factors that we put ourselves through, and it's the usual culprits: smoking, diabetes, hypertension, processed foods, and hyperlipidemia. All these things, along with stress, contribute to the illness. And it doesn't just affect the memory, by the way. It can affect personalities. You lose that braking system and you become an angry drunk.
I've read about that. Well, do we have time to talk about something a little bit easier?
Yeah.
Okay, we're going to talk about bananas.
Yes,
By
we
the
have.
way, my grandchildren call me Banana Nana.
Okay.
Okay, this fruit is the first superfruit. It's packed with fiber to make you feel full and vitamins that do your body good. 19% of a woman's potassium needs are there. It manages blood pressure, helps vitamin 6, and it's good for the brat diet. So if you are sick, you need to have bananas, rice, applesauce, and toast. And there's the bananas, the brat diet.
Very good.
And do you know what a single banana is called?
No, tell me.
It's called a finger.
Oh, really? A finger? No kidding.
And what happens when you buy a bunch of them? Oops, they're not a bunch.
They're not a bunch of bananas? No. What are they?
They're a hand. The bunches only grow out in, Ecuador or wherever else, and they're bunches of them together, but they're not really bunches. They're a bunch. They're hands that create a bunch from the finger.
Okay. And, by the way, there's a cross-reaction to latex allergies, correct?
Exactly.
All right. Yes, we have no bananas. We'll be right back after this brief commercial message from It's Your Health.
Welcome back, and of course there has to be a mention of dogs somewhere. I found this, and it's so true. Let's be real. It's your dog's house. You just cover the expenses. Ain't that the truth?
How true.
They're not going out and working. They're not cooking dinner. They're not doing the laundry.
Not paying taxes.
Yeah, they're just living the life.
Just like you.
Yeah, just like me.
Okay. You're my pet, let's face it.
Oh, no. Just, Sammy, save that comment for the future. Okay, let's talk about fruit juice and your risk of type 2 diabetes. That's our first headline. Tell us about that.
Well, it depends which poison you're picking, if you will. If you have a pure 100% fruit juice, that's generally not going to get us into trouble. But a lot of fruit juices have a smidgen of the real fruit juice and have all these other additives.
Especially sugar.
Corn syrup and the like. And those are the ones that can lead, statistically, according to this journal article, to diabetes, because it's just like pure sugar. So if you're going to drink a juice, make sure it's 100% of whatever it is with no additives.
Or buy the fruit and make the juice yourself.
Okay, I'll bring some home and we'll see where that goes.
Okay, that sounds good, especially since he's doing it.
Okay.
Next headline. Biosocial variation in treatment response to GLP-1s. He will explain that, but there's considerable variation around the average treatment response of GLP-1. Biology and biography on physiological symptoms affect both the risk for being overweight and the response to the treatment of GLP-1.
Sir William Osler, who's like invented medicine like a couple of 100 years ago, said this. He said that variability is the law of life, and no two faces are the same, no two bodies are alike, and no two individuals react alike and behave alike under the abnormal conditions which we know as disease. And that is something we see all the time. We prescribe something like a GLP-1 to a patient. They'll lose 20 pounds in a couple months. We'll prescribe GLP-1s to another patient, and no matter what the dose, they may gain weight. They don't lose an ounce. Why? Everybody's different. There's no pill for every ill. Sorry.
Okay, well, that explains that. Oh, we're back to talking about dogs in our third headline. The best doctor is the mouth of the dog. There's a long-standing belief in the healing properties of canine saliva. Canine saliva contains compounds with mild antibacterial properties.
Yeah, this is from the Green Journal, the American Journal of Medicine. Now it goes back to the Middle Ages where they didn't have antibiotics. So maybe a dog licking a wound would be better than nothing. But nevertheless, there is some antibacterial properties to a dog's saliva, but I wouldn't count on it.
And you know, when a dog has an illness or a wound, if you have another dog, they will go and
Yes.
lick that area.
Exactly.
Okay.
Exactly.
Are you dehydrated?
Probably, yes.
When you lose more water than you take in, it makes it harder for your body to do basic jobs like keep your temperature steady and clear out waste.
Well, they claim that the Earth is 3/4 water, and our bodies are 3/4 water, but our diets and intake of food and fluids is not. So dehydration is a real thing.
Mild dehydration can make you feel tired and even give you a headache. It will affect your mental focus, your mood, and your memory. So you got to take care of that.
Yep.
Okay, I have a question for you now. I keep seeing all these ads on television that I need to take this vaccine and that vaccine, another I could be doing that forever, taking vaccines.
Right. I mean, how many can you take?
What vaccines do I need?
Okay.
What do people in general need?
Around this time of year, we need to focus in on COVID, influenza, and RSV, of which we have vaccines available. And there's a list on your full screen about when you should get them.
So COVID is still here.
COVID is still here, and we're worried about not necessarily COVID-19, we're worried about COVID-25. this year, 25.
Wow.
But there are a whole host of other vaccines that you should look into getting. A tetanus shot, the shingles vaccine, of course, up to date on hepatitis B vaccinations. So the list goes on and on. Check with your healthcare provider.
Okay, I'm glad that was your job to do and explain. Here's a good one. Antidepressants versus placebo for moderate to severe anxiety. First of all, tell us what a placebo is.
It's not a medicine, it's like a sugar pill. So when they do a study, they'll give so many in the group a sugar pill, which has no effect, and they give the actual medication, which should have an effect, and they compare the two.
Okay, treatment begins with education. That's the first thing they recommend for anxiety. Then it's for high intensity psychological intervention. And if none of that works, then to consider medication.
Yeah, talk therapy, of course, is the best. And it's interesting that we're using antidepressants, such as Zoloft, for example, which is listed to take care of depressive symptoms. But here, at least 50% of the patients got improvement in their generalized anxiety disorder with the use of these medications. Why is that important? Because we want to stay away from these benzodiazepines, Ativan, Xanax. They have addictive properties. They increase the fall risk. They may lead to some dementing illnesses later on in life. And so we want to steer away from those and take something that doesn't have those properties or potential side effects. And guess what? We get a good effect out of it anyway. So win-win.
Okay, so you're on a roll here. So I'm just going to ask you questions and you can answer them. What are the best return to activity steps if someone's had a sports-related concussion?
That's a problem because the brain sits in water in our skull, and when you get a concussion, the brain hits one side of the bone, which isn't going to move, and then ricochets back to hit the contralateral, called contre coup, by the way, in French, the contre coup concussions. So that's typical of a brain injury, and it's sort of like a machine that gets tilted, if you will, and everything shuts down. You may lose consciousness, but nevertheless, if you have a concussion, we have a concussion clinic at Lehigh Valley right here in the area that we can enroll you in that will do a better job at following through with concussive symptoms and get you back on the road to recovery. The main issue is if you had a concussion, when you send the guy back in to play football and they have another, that's when a lot of things can go wrong. So you got to treat concussions very seriously. They're traumatic brain injuries. And so we have a clinic and an availability to get you back to where you should be.
And right after the concussion, you need to have rest, avoid screen time and limited activities, and immediately, and then 2 days afterwards, light activity. And on that, we'll take some light activity and take a break.
Be right back.
Okay. This is my favorite comment in a long time. The waiter is saying to the man, "How do you like your steak, sir?" And he says, "Like winning an argument with my wife." And the waiter says, "Rare it is."
Very rare, yes indeed. Raw,
for
maybe,
sure.
who knows?
Well, listen, we started off asking some questions. I'm going to continue asking you a couple more questions.
Alrighty.
What's the next step after initial positive PSA test? And first tell us what the PSA test is.
Right. Prostate-specific antigen. It's a blood test that we like to use and screen for prostate cancer, usually at the age of 50. If you have a family history of prostate cancer, we generally would like to do that a little earlier. And 0 to 4 is considered normal, if you will. Once it goes higher than 4, our eyebrows go up and say, well, why is this happening? And the other thing that happens is there's a velocity of change, which is also important. If you have a PSA of 1, and then next year it's 3, well, that's still under 4,
But that's a lot.
Yeah, the velocity of change is what also gets our interest. If you have an elevation, you certainly may consider seeing a urologist. We would generally wait a couple of months and repeat it, like any test that's abnormal. And keep in mind that if you're a truck driver and you're bouncing down on a car seat or a truck seat, that's going to press out more PSA juice, if you will, for lack of a better word. And your PSA could be elevated because of activity, both exercise and intimate activity, by the way.
Okay, well, last question for now. How effective is vitamin E for Alzheimer's dementia?
Right. Again, this was from a family practice journal, and everybody's trying to do something because they don't want to hear that there's nothing we can do. So vitamin E was, of course, touted as slowing down or reversing Alzheimer's disease. You're wasting your money. It doesn't work. Vitamin E.
But it's good generally to take.
Generally, I would like to take a multivitamin, a little bit of everything, yes.
Okay. Talking about a little bit of everything, let's talk about the best foods as you get older. See, Sammy doesn't have to worry about that because he's so young yet. He's not like us. But he'd like to know for future reference.
All right, we're going to go to the full screen again. Of course, we're talking about fiber. Fiber is in fruits and vegetables, not so much in processed foods or animal products. So you'd want to key
It
in on.
helps with constipation.
That's Metamucil there. Whole grains, again, just not a regular loaf of bread, but get the stuff with that have folate and B6, and these are ones that have grains in them, whole grains, and it also lowers your chance of diabetes.
Not just plain whole wheat bread.
Yeah, get the stuff that has a lot of stuff in it. There you go. And it's a little pricey, by the way, but nevertheless worth it.
But it's good.
Nuts, tree nuts, almonds, walnuts, cashews, pecans. These things are
And
excellent.
pistachio's my favorite.
Again, they cut down on these things that are age-related heart disease, stroke, diabetes, nerve damage, things along those lines.
And they protect your brain as you age also.
How about water? We talked about that.
Yeah, we know about that.
You got to push the water. Fish is something we generally don't get into that much because I think when they were worried about fish having metals in them, heavy metals. But nevertheless, fatty fish like salmon, tuna, herring, all will help you because they have high omega-3 fatty acids. The natural ones are the best. And that can protect your health as well, brain health and vascular health.
And they help, supposedly they think they help with getting Alzheimer's.
Lean protein, of course, fight natural muscle loss that happens as we get older. Rather than a protein supplement, eat the real
We
thing.
talked about that.
Eggs, lean meat, dairy products are excellent examples. Dairy products rich in calcium, vitamin D, lowers the risk of cancer, osteoporosis, high blood pressure, right? Blueberries.
One of my
You
favorites.
like that in your ice cream, right?
I like that anytime.
Right. Again, they are good for brain health. And red and orange colored produce.
Watermelon, tomatoes, bell peppers.
All those things are good. They lower your risks of some cancers. And then there's cruciferous,
Cruciferous.
easy for you to say,
Yeah,
vegetables. These are the ones nobody likes. Brussels
I
sprouts,
like them.
broccoli, cauliflower. All those things are great because they have these chemicals in them that protect and maintain our health.
And you should never boil them. You can steam them, but boiling takes away a lot of their benefits.
Dark leafy greens, cataracts, macular degeneration, avocado, and sweet potato.
Wait, sweet potatoes, I love them, and they provide more than 3 cups of cooked, 23 cups of broccoli you need to eat to have the same effect as 1 sweet potato.
And just like marriage, you need spice. They do more than just give you food flavors. Some spices have antioxidant properties, for instance, garlic and cinnamon along the lines there.
And there is you can get cinnamon and garlic as supplements, but you're better off eating them the way they come, right?
Exactly, yes.
Okay. Well, it looks like we're getting near the end. I think Sammy's getting impatient over there, you know? So we do have something important to talk about. So let's dwell on that for the
Go right
end.
ahead.
No, you. This is yours.
Well, when patients come into our office, we ask them all kinds of questions. You know, do you have guns in the home? Are you safe? What about your intimate experience? And no one asks them about their spirituality or their religious preference. And I'm not sure why they don't include that, because in my line of work, it's a keystone of treatment. And people are like a desert. They are so thirsty for spirituality in their life. And to come to the doctor's office and have that entertained as a topic is something that I personally find very rewarding, because people like to talk about not only their health,
But they like to talk about that too.
their spiritual health. And so again, this was from the New England Journal of Medicine. It suggested that as healthcare providers, we need to address faith and spirituality. We don't get taught that in med school. And again, it's a personal thing. Some people respond to it, some don't. And we never ask it in the office setting. So here's a medical journal saying, get your act together and let's start asking about people's spiritual health.
So get your act together.
Okay. Thank you for watching yet another edition of It's Your Health. We're proud to be on Samsung Productions list here.
Absolutely, yes.
Check with your healthcare provider, and we're happy to entertain you and inform you at the same time. So we'll...
And see you before Christmas.
Right. All right. Say goodbye, sweetheart.
Goodbye, sweetheart.
Oh, she is.